welcome to CCHF Talk. In this series, you get to meet people that are strategic partners with CCHF, people and organizations who help us do what we do efficiently, effectively, and most importantly, faithfully. Today, we're talking with a longtime friend and CCHF stakeholder, Bob Mason. Bob is the Executive Director for the Medical Strategic Network. Many of our folks will know Bob from the many times that he has presented workshops at conferences, the CCHF conference, Global Missions Health Conference, and other conferences. Or maybe some will know him through the METS conferences that he leads all around the country and has now for well over a decade. METS conferences train healthcare professionals and patient care staff how to have meaningful spiritual health discussions with their patients. So, Bob, thank you so much for sharing your time with us this afternoon. I appreciate you.
It's great to be here, Steve. Thanks for the opportunity. Great to see you again.
Yeah. Well, you're well known. You've been doing this longer than I have, and you were well established in this type of ministry before. When I first came on as the new executive director of CCHF. But for those who are new, or maybe for students that are seeing this, tell us a little bit about Medical Strategic Network and what you guys do and the history of that and all that.
Yeah, well, MSN was actually started by a physician, a gastroenterologist, the late Young Chin. Dr. Chen was born in the Philippines, Chinese in terms of his ethnic heritage. Did his undergrad in the Philippines and med school in the Philippines. And as a med student, wanted to be about kingdom work and wanted his life to count for that. But was beginning to see that, the demands of medicine and healthcare would mean limited time to do other things. And that was a little frustrating to him and some other Christ followers that he had connected with. And through all that and that angst, if you will, God showed up and said, maybe your best place for ministry is with your patients and in the healthcare setting. So those men and women just sort of put some ideas together about how they could not only care for the medical needs of their patients, but also the spiritual needs of their patients as well in an ethical, professional, patient-centered manner, and started training their colleagues to do that and expanded to the U.S. Young actually came to the U.S., did residency, fellowship in GI at the Mayo Clinic, and then started his practice and continued his ministry. So that's sort of how all this started.
Yeah. Talk about the name, Medical Strategic Network.
I think I wasn't around when they named it, or at least with the network, and I think they wanted to. I mean, it wasn't about it being a membership organization. I mean, you can't really join Medical Strategic Network because it's a network, and I think ultimately they wanted it to be somewhat of a movement among healthcare professionals and students in terms of integrating faith into patient care. It's medical, but it's actually, our interest in our scope is basically anybody in healthcare that's going to have patient contact.
Yeah, I know people who have benefited from your training that are not patient. They're not providers. They are patient interface professionals, but it's super helpful for anybody that has any contact with patients. So, and share a little bit about what you guys do. What's Medical Strategic Network's main thing?
Well, I think our main thing, as already alluded to, is equipping healthcare students and healthcare professionals to provide what medical literature refers to, and nursing literature, et cetera, refers to as a whole person care. And that is seeing their patients as not just the kidney disease down the hall, or the chronic fatigue, or even the frequent flyers, if you will, in the emergency department, but recognizing that these people, yes, there's maybe some type of medical condition, but there's a spiritual side of them as well. And the thing that I get really excited about, or one of the things I get excited about, is that when you start talking about the spiritual needs, we're not talking about this something that has no clinical relevance. A lot of times patients show up in a clinic or at the hospital because ultimately the need is spiritual, and there's an unmet spiritual need that's manifesting itself in physical symptoms and in a variety of ways. And so to ignore that could really sort of be not only short-sighted, but maybe not in the best interest of your patient as well.
Yeah. And you guys do this training. How do you talk about how you do the training?
A number of ways. We're well known for conferences that we do, and we have done those around the country. Just this month, 3 weeks ago, I was in Miami and working with primarily a sort of a mixture group of healthcare students and professionals. A couple of weeks ago, we were in Boston, really strategic healthcare community. And we were connecting with people in practice, students, and even a few undergrad students. So we do our conferences, and the other thing that we do is a lot of student work, especially in Southern California. One of probably the best things we do is a summer preceptorship for students who are in healthcare, medical, dental, nursing, PT, OT, pharmacy, that type of thing. They spend 4 weeks with us in Southern California, really a deep dive into learning how to do whole person care, and also sort of replenishing and growing in their walk with Jesus.
Yeah. Well, I've been to both the conferences.
That's right.
I went to a conference in Tulsa that was hosted by In His Image some years ago. It was really, really helpful. It was super. And then, you've had me out to the, and Jesse Thomas out to the, the student summer program, which is fantastic. If you go on your website, what is your website?
It's medsn.org.
medsn.org.
Yeah.
Anyway,
somebody else had msn.com. Some little yeah. We didn't have the deep pockets to go after that name.
Yeah. Well, there's a number of videos of just testimonials of students whose lives have really been changed, and it really changes the way you think about your career in medicine. It's not. It really integrates your faith in healthcare in medicine, and then.
And Steve,
medicine, not faith in medicine, but
yeah, and I think the other thing that it does, and somebody mentioned this in Boston, but I think a lot of healthcare professionals, I think most healthcare professionals went into this field because they wanted to help people, obviously. A lot of Christians went into this because they wanted to help people and they wanted to integrate their faith, but a lot of times that sort of gets drowned out. But what I have seen over and over and over, doing this type of thing is not only beneficial, but it's incredibly beneficial to the clinician and the provider as well. We were at our conference in Boston. I think the lady was a physician's assistant, and she said, I have been burned out for a long time in terms of her job, in terms of taking care of patients and all this. And she said, this is the first time in a long time, and this was at the end of our conference, where I am looking forward to going to work on Monday, because of what I've learned here and the opportunities that I have to care for my patients at a different level now. And so I think this doing this type of thing can be incredibly life-giving to the people who are providing this type of care.
Yeah, when you are reawakened to the reason God called you into this type of work, which is to serve and I believe healthcare is a compassion ministry first and foremost, and it's hard, I think, to ignore the spiritual side of that with patients. Patients don't want you to ignore it. They're generally very, very grateful for their providers or their healthcare workers to address things, but it stops medicine from being just one more rotation on the rat race wheel, and all of a sudden we have a higher purpose and we're reconnected with that higher purpose.
Mm-hmm. Yeah. I think you're right. And I remember one study, they found that they were talking to surgery patients, and they found out that not only did they desire, as you said, for spiritual care or for their surgeon to ask them spiritual history questions, but they also found out that the patient's opinion of that surgeon would increase if they did that type of thing.
Yeah. I've had surgeons that I've had that discussion with before. It's like, if you prayed for me, I'd feel a lot better about you. Or if you just prayed at all, I'd feel a lot better about you. But
yeah,
it's true. It is true. One of the things that I appreciated when I went through one of the conferences was the amount of time that you spent talking about the ethics behind, about being cognizant of the provider-patient, relationship, and to not be, to do this in a way that doesn't make the patient feel pressured or
right.
that kind of thing. So, and just the ethics behind it, like, why is this something that's just sort of a tack on to what we do, or is this really healthcare? And it really is.
Yeah.
Amazing.
Yeah. And the evidence just has shown that time and time and time again.
Yeah. Well, I can't speak high enough about the just the conferences that you put on. You've done several just for CCHF CCHF clinics, haven't you?
We've done a few. We were up in Chicago, I think, last year with our friends at Lawndale.
Yeah.
And so that was a lot of fun. And another thing is, through CCHF, we have been able to serve an entire clinic system over in LA, Central Neighbors Christian healthcare clinics. And not so much doing a conference, but doing ongoing training with their clinicians, their mental health people, their medical assistants, and going into each clinic, I think, for like 8 weeks at a time, and doing dedicated training sessions on how they can go about providing spiritual care to the people that come to them for help.
Is that something you want to do more of?
That I think everybody has enjoyed this. I remember, and the answer is yes. And I remember starting out in one clinic in Los Angeles. It was, it was actually in the Inglewood neighborhood, mm-hmm. and right around the corner from SoFi Stadium. And after I did the first introductory session, there was a lady who came back and told me, she said, I had been praying for something like this and I don't know how long she told me she had been praying for it. But I think people have enjoyed it, and I've enjoyed it, and I think it's been incredibly strategic and beneficial. And yeah, I would that would love to have opportunities to serve other clinics in that way.
Yeah, I think clinic leaders should understand that this actually doesn't just go towards training, which is really helpful for the providers, and really helpful for the patients too. But it also helps with retention, helps with the culture of the organization, esprit de corps. Um, I think it's really beneficial.
Hmm.
What would it take? I mean, what does it take to put on a conference? If there was a clinic, I know you've done stuff for Central Neighborhood and for Lawndale, but like, what do you if another CCHF clinic said, I think maybe this would be a good thing for some of our staff to go through. Like, walk me through one of the conferences and kind
Yeah.
of what the requirements would be and that kind of stuff.
Well, I think, we love being able to go in and work alongside of people like local hosts, and that's sort of what Lawndale did. The majority of the people who attended that conference in Chicago were connected with Lawndale, but not all of them. There were some, medical students, and there were some professionals from the community that were there as well. But in that particular setting, we started on a Friday night, and we went, I think, from about 9 a.m. to about 4 p.m. on Saturday afternoon. When we were in Miami, we didn't start on Friday night. We just did all day Saturday type thing. We can do it. We could do it during the week, but a lot of times, because of schedules and patient appointments and so forth, local clinics like that prefer, if we're going to do like an entire conference, they prefer to do it on a weekend. So that's what it would sort of look like. At our conferences, the people who are doing the training are clinicians themselves, who they themselves practice whole person care, and I always like being in those situations, because often our faculty are really fresh in their experiences. It's almost always like, I had a patient last week, and they tell the story. It's not like, I remember back in 1986, I had this one patient that I prayed with, and that
Yeah.
was really
Mm-hmm.
good. But they're really current, and that, I think, just brings a wealth of information to the table. So if somebody's interested, contact us through our website or through you, Steve, or
Yeah.
CCHF. We'd love to talk.
Typically, how many people do you like to have at a conference?
I think 25 to 50 is a really nice sweet spot for us, and that provides still somewhat of an intimate setting. And then it also, one of the really key distinctives of our conference is we will have some type of field experience. Before the pandemic, we would actually, during the conference, we would have negotiated with a local healthcare facility to be able to take conferees into like a hospital to visit with patient bedside and begin to practice some of the things they had learned in terms of taking a spiritual history, getting some idea of how to, just in a very basic way, assess and recognize the spiritual need and spiritual openness. But when the pandemic hit, that just shut all that down. But God gave, actually, my wife this idea of doing these field experiences virtually. And so what we've been doing since the pandemic is we just everybody get on devices, and we have virtual patients come in. And on one level, we found that is actually maybe a superior training
Mm.
situation than going into a hospital and hoping that we find patients who are alert, willing to talk and interact with us. So that 25 to 50 allows us to have a really good practicum experience as well.
Yeah, that's great. You were sharing with me before we started recording about an experience you had just last week. You want to share that a little bit?
Yeah, every Friday in Southern California at the med school we're connected with, we do a spiritual care practicum for students, medical students primarily. And we do some training and taking a spiritual history, assessing, addressing spiritual needs. And then we actually take the students over to a med center. And last Friday afternoon, as I was coaching two medical students, connected with a patient, obvious spiritual need, wanted to have that need addressed, gave us permission. Um, Long and short of it, got to share the gospel with this patient, not because we wanted to do that. That's what the patient needed. And that's what the patient had actually, requested. Yeah, how can I connect with God in a more
Yeah.
meaningful way? And shared the gospel with this guy, and he trusted Christ. And, in those situations, a lot of times people will ask, well, what about follow-up? You're never going to see them again. And there's a great resource out there called startingwithgod.com. Startingwithgod.com. And I gave that to that guy. I got him to get his phone out, and he looked up that website, and I told him to bookmark it and look at it later. We talked about where to start reading in the Bible, encouraged him to start reading in the book of John. And we talked about a couple of churches in his area that I'm familiar with, good, solid, evangelical Bible teaching churches. Said, why don't you go check that out? And then I also told him to watch the Jesus Revolution movie. He said he had Netflix. He actually told me, he said, I have a friend who's been sending me clips of that. And so, maybe a little bit of that Jesus, what they call it, the Jesus movement or whatever,
Yeah.
will continue
Jesus.
on. But that was a I would be excited about any opportunity to train a med student, regardless of a patient response. But it's really cool when you get to intersect the patient's life where
Yeah.
there's a clear spiritual need that they recognize, that they want to have addressed, and they give you permission to do that.
Well, and if you're not a med student in Southern California, the summer program that you guys put on is phenomenal. It's really, really good, and
Yeah.
and very transformative.
Yeah.
So they should, students should look into that.
Yeah. Yeah.
So,
Yeah, I think it's probably the best thing that we do. And
yeah,
students tell us it's the best summer of their life. One of the things that med students are very apprehensive about is residency match and feel like they have to do research. And if they don't do research, especially the summer after their first year in med school, their professional lives are going to be over because they're not going to be competitive. But so many of our preceptorship alumni have told us that this experience on their CV is actually maybe incredibly valuable, to the degree that many times during their residency interviews, the interviewer will note, well, what's this whole person care preceptorship? And they will spend the entire time talking about that. The interviewers are just fascinated. And this experience can actually distinguish students from everybody else who has the research, who has the letters of recommendations. Now, those things might be important, and I'm not saying not do those, but this could be more advantageous in terms of your CV and your residency applications, and then you might be aware.
yeah. I agree. I actually, I talk to a lot of students and have for the past 17 years, and I get the same thing over and over and again. I'm being encouraged by my preceptors in my at med school that I need to do research this summer, and I always ask them, why did you want to be a doctor to begin with?
Mm.
And
Yeah.
the vast majority of the ones that I'm talking to say, well, I want to serve Jesus missionally. It's like, all right, do you feel after, this far into your first year, do you feel that you're more on track spiritually or less on track spiritually than you were when you started? 100 students out of 100 will say, well, yeah, I'm not spending time with God like I used to.
Yeah.
I'm not in a church like I ought to be. Like some of them are really trying, but first year med school,
It's tough.
it's tough. It's a different world, and
Yeah.
it's easy to get knocked off. And
Yeah.
I always encourage students, like, make your decision about what you're going to do this last summer of your life for the next 7 years. Like make a decision about how you're going to use that time around what is going to keep me on track missionally with
Yeah.
why God called me into medicine.
Hmm.
And honestly, I think many times, probably maybe not 100% of the time, but maybe only 97% of the time, it should be to do something like your summer program or take a missions trip. The nice thing about your summer program is there's a curriculum, there is research involved, and study and skill sets that are being developed that can help them. SMI is another program on the East Coast
Hmm.
that we put
Hmm.
on in
Hmm.
Philadelphia. But I think those kind of programs can go a lot further in helping people stay on mission and be prepared. And God will open the right door for them with residency.
Yeah, yeah. I couldn't agree more, Steve. And I have seen that too. It's not that the students decide, okay, I'm going to put God on the shelf and not have anything to do with that anymore.
No.
But the rigors of their training just sort of squeezes. And so by November, certainly February, March, April, I mean they're just sort of depleted,
Yeah.
spiritually, emotionally, in some ways intellectually. And so I think these type of experiences can not only be good professionally, but personally and spiritually in terms of a replenishing opportunity. And the other thing is, you said God has gotten you so far. I am fully convinced if God lays it on the heart of a student you need to go to Philadelphia, or you need to go to Southern California, or you need to go do this. I think God is big enough. If we are obedient at those points, I think He's big enough to deliver His will on
Yeah.
that Friday morning on match day. Um,
That's right. That's right.
and I, I'm thinking of an oncologist who ranked into one of the most prestigious internal medicine programs in the country. And when he got there, he was like looking around at his classmates and just brilliant people. And he told me, he said, I was wondering, how did I get here? How did I get in here? And he ended up having a conversation with one of the residence faculty. I think it may have been the director. And they said, and I don't think he asked how I got in here, but they said, you know why we picked you? You know why I wanted you here? Because I read in your personal statement about you doing spiritual care. And when I saw that, I thought, I want that guy in my program.
Yeah.
And it wasn't the research. It wasn't the great letters of rec that he had that set him apart. It ultimately came back to him being willing to trust God as God was leading him. And at that point, I remember he told me, he said, I had the primo research opportunity in the bag. The director herself has said, I want you. And he said, God started telling me, that's not what I
Yeah.
have planned for you. And to
Yeah.
step away from that was a huge step of faith. But God delivered on match day.
Yeah. I've been interviewing docs that have been kind of foundational docs in the CCHF world for years. And, I think about Daisy Dowell, Dr. Daisy Dowell and Dr.
Yeah.
Bob Peglow. They have stories like that. It's like, just how God shows up If you are obedient to him, he's going to lead you in the right ways.
Yeah.
So anyway, that's great.
Yeah.
Hey, I don't want to take up too much more of your time, but let me ask you. You know CCHF really well,
Hmm.
and I just, by the way, I want to say thank you for being at every conference that I have put on. I think, uh,
It's been fun.
yeah, and just imparting what you know to our folks at the conference and that kind of thing. That's great. It's not a substitute for the Mets program. It's a really good warm up to that. But honestly, your workshops have been really helpful to so many people, and you're going to be at this one in April that's coming up. And
Hmm.
anybody that wants to, like, just Google your name in the CCHF website, do the search within the CCHF website. It'll show some of the workshops that you've done on ethics and on taking a spiritual history. And you've got one coming up this year on how to do this and stay on track in terms of productivity. Like,
Yeah.
is I don't have enough time. Is that a
Hmm.
really good excuse for this? So I think that's going to be a really popular workshop. But thank you for doing that. But
You're
tell me,
welcome.
like, CCHF, and how would you like to see our partnership grow or be better? How could we be a better partner with you?
Well, I think it's just such a great partnership. I think it's a win-win thing, and I hope it's a win-win for the body of Christ, and I think for CCHF and the people involved in that to continue to recognize the tremendous work that people that are associated with CCHF are doing. You look throughout history, and what has often gotten the world's attention, and it's Christ followers caring for the poor, or Christ followers
Yeah.
caring for the less fortunate. And so you've got that side. We're bringing or complementing that. We're not the only ones with the spiritual care. So I think just continued partnership and interaction would be huge, and resourcing each other. I'm always pointing people and students and professionals to CCHF.
Yeah.
I I I I I can't remember the first conference I came to, but they've always been encouraging to me. I go to a lot of conferences, and there's something really sweet about the CCHF National Conference, and something about the way that you guys encourage people, and I've been the beneficiary of that, and it's really cool to watch others be the beneficiary of that. And so the things that we can do together in connecting people with each other, if we can do more of that, that'd be great.
Great. Well, I want to encourage folks to visit your website, medicalsn.org.
Or medsn.org. Maybe we can,
medsn.org. Okay.
yeah, maybe and maybe it can flash up somewhere.
Yeah, we'll figure it out. And if you have any questions and can't find it, you can contact us, and I can put you on to. If you just Google Bob Mason spiritual care, that's going to show up.
Should hit it. Yeah.
Thank you for investing your life in this, Bob. No telling how many people have had a real encounter with God at a critical point in their lives because you trained somebody or provided training for somebody to help them.
Or facilitated. It's not just me. We've got a whole team of people, and we're trying to multiply that.
Yeah. All right. Well, brother, you've been a good friend and a great partner. Thanks so much.
Likewise.
I'll see you in a week.
Yeah. All right. Thank you, Steve.
All
God
right.
bless.